Hi guys, welcome to Doctors of Medicine. This is our first lecture series on neurophysiology and neuroanatomy. So today we're going to talk about the cerebrospinal fluid, the famous CSF. Now, let's get into it. Right here you see this is your brain, and then you're going to have your right cerebral hemisphere, your left cerebral hemisphere, your midbrain, and your brainstem, right? So the brain is about 1.5 kgs. It weighs 1.5 kg. But because it is suspended into a fluid called cerebrospinal fluid, it's going to weigh about 50 grams. So one function of the cerebrospinal fluid, it reduces the weight of the brain. Right. The cerebrospinal fluid is going to be an ultrafiltration of your plasma, which means it's going to come from the plasma, but it will not going to be the same as the plasma. So there are certain things that you find in a high concentration in the plasma that are not in a high concentration in the cerebrospinal fluid, and certain things that are in the cerebrospinal fluid that are in low concentration there that may have a high concentration in the blood plasma. So that is very important for you to understand before we get any further. All right. The brain, it receives about 15% of the cardiac output. And within that 15%, daily the brain uses about 100 grams of glucose. Just imagine. Because of that, the brain is divided into you're going to have an outer gray layer, a gray matter, an inner white matter, right? As we're going to look into in other lectures. But it's so important for you to understand that the brain uses about 100 grams of glucose. The gray matter using 80% because that's where your cell bodies are found. And then you have 20% being burned by other tissues within the brain. Right. So what regulates this cerebrospinal fluid? Right. So the cerebrospinal fluid is mainly going to be affected by three substances. You're going to have your carbon dioxide, the concentration of hydrogen, and the concentration of your oxygen. Right. So these substances will affect the increase and decrease of what's called cerebral blood flow. Because an increase in cerebral blood flow will increase cerebrospinal fluid. So just take note of this. In a high carbon dioxide concentration, you're going to have an increase in cerebral blood flow. In a high proton concentration, which is your H plus, which means if you are going to have an acidic condition, you're going to increase cerebral blood flow. And then high oxygen concentration does not affect cerebral blood flow, but rather the decrease of oxygen is very important to understand here, is the one that affects the flow of cerebrospinal fluid, right? So if someone has a hypoxia, that hypoxia is going to increase cerebral blood flow, right? So understand this. You have about 3.5 millimoles of oxygen, which are used per 100 grams of brain per minute. So if that 3.5 mils of oxygen decreases, you're going to affect or increase the cerebral blood flow, which will increase your CSF. You understand? So that is very important as far as the regulation of cerebrospinal fluid is concerned. All right. So let's take a look at the production of the cerebrospinal fluid. Where is it produced? What happens to the production of the cerebrospinal fluid? Right. So in the brain, you're going to have spaces or cavities, which are called ventricles. So you're going to have 4 ventricles, right? How many? 4 ventricles. So each cerebral hemisphere, the right and the left, they're going to have lateral hemisphere, lateral ventricles. So you're going to have a right lateral ventricle, as you can see this in blue, and then you're going to have another one being the left lateral ventricle. You understand? And then from the lateral end, from the lateral ventricle, we are going to have the third ventricle. Then from the third ventricle, we are going to have a fourth ventricle, which is found in the brainstem. Right. So cerebrospinal fluid is going to be formed by a plexus called a choroid plexus. So you can see in the ventricles, you are going to have choroid plexus. So the choroid plexus is found in the lateral ventricle, third ventricle, and fourth ventricle, as you see right here. Right. Right. So this choroid plexus has brain capillaries. So these brain capillaries, they're going to have a fenestrated capillary. These are fenestrated capillary, which means their endothelium lining is going to have spaces, right? So you're going to have blood plasma, right, which will move from the lumen of these capillaries, gets into or gets into the ventricles via the following layers. So first, the plasma will cross the fenestrated endothelium. After it crosses the pericytes. Remember, your capillaries always have pericytes, right? Which we say they substitute the tunica media in other larger vein vessels, right? And then from the pericytes, you're going to pass what's called cells, epidermal cells. So the ventricles, they are going to be lined by a special kind of epithelia called epidermal cells. So these epidermal cells, NB, these are epithelial cells with no basement membrane. They have no basement membrane. So let's take a look at the diagram. Right. So right here, this is a cross section of your brain. You can actually see this, the right and left lateral ventricles. If we zoom right here, we are going to see something like this. So this is a ventricle where your cerebrospinal fluid is found, as we're going to see. And then you can see that this ventricle is going to be lined by these epidermal cells that we say they have no basement membrane. So these are going to modify the plasma to cerebrospinal fluid. Right. Let's take a look at another closer diagram to see what really happened as the blood plasma crosses these epidermal cells to produce the cerebrospinal fluid. Right, so this is your lateral ventricles, this is your third ventricle, right? So if we zoom right here at the choroid plexus, this is what we are going to see. We're going to have brain capillaries, which are going to be fenestrated capillaries, right? They're going to have an endothelial lining, a fenestrated endothelial lining, and then they're also going to have pericytes right here, which are not shown. So you're going to have your plasma moving from the fenestrated endothelium, crosses the pericytes, and then they meet these giant endodermal cells. So that's where the modification comes. So you're going to see that as this blood plasma passes through this epidermal cell, it's going to graduate from plasma to cerebrospinal fluid. Let's take a look. Look at this, how amazing it is. There are so many channels, right? So you're actually going to have certain things that are found in blood plasma, right? Which are not found in the cerebrospinal fluid. Very important. Right. So for instance, let's take a look at the comparison between the cerebrospinal fluid and the blood plasma. Let's take a look. Right. So this is a good diagram to actually show the difference. So what I want you to mark is, I want you to mark here, which is important, the potassium. I want you to mark the pH. I want you to mark the amino acids and the proteins, and I want you to mark the glucose, which is not here. Right. So in the plasma, you're going to have more potassium than the potassium that is going to be found in the CHF, as you can see. So in the plasma, you have about 4.7, right? And then in CSF, you have about 2.9. So in CSF, you have low plasma. Check. Then in terms of pH, you have more potassium, you have more hydrogen concentration in the CSF. So the CSF is more acidic than the plasma. True or false? True. Because of this, it's a true, right? And then you actually have no very few proteins and amino acids within your cerebrospinal fluid, nearly close to zero. Nearly close to zero. So you can see here we have 7 grams per deciliter, but here we have 0.3 grams per deciliter. You understand? But in terms of the osmolarity is the same, right? 290, 290, the same. Now take a look. There is something that they left here. That is glucose. When it comes to glucose, we said the brain uses about 100 grams of glucose per day. But the glucose in the brain is going to be less than the glucose in the plasma. So you have about 900 of glucose in the brain, and then about 300, right? So the ratio of glucose in the brain is going to be 1:3 to that of the plasma. So in the brain, you're going to have about 1/3, and then in the plasma, you have 2/3 of glucose. Very important. So I hope we understand that the plasma is not the same as the cerebrospinal fluid. These fluids, they are totally different in terms of their um, composition. Right, good. Let's take a look now. We have produced our cerebrospinal fluid. Let's take a look at the movement of the cerebrospinal fluid in the ventricle. Let's take a look. Right, so this is the diagram to summarize the movement of cerebrospinal fluid in the brain. Good, right. So there's something that I left before I go any further. Your brain baths 3 times a day. Do you know that? Why? Because this cerebrospinal fluid is going to be removed, or there's what you call turnover of CSF. So there's turnover of CSF that's going to happen 3 times a day, right? So the total volume of CSF in the brain, it has to be 150 uh, milliliters. 150 milliliters. So you have about 150 milliliters within 8 hours a day. So within 8 hours a day, you have 150 milliliters. And then after every 8 hours, that 150 millimeters is absorbed, as we're going to see how it's going to be absorbed. And then we produce another 150 for the next 8 hours. And then we reabsorb that one and produce. So the brain baths 3 times a day. And you only bath it twice, or you don't even take a bath. Imagine. All right, it's so fascinating, right? So we spoke of how the CSF is produced. Now I want to take a look at the movement. How does it move within the brain? So this CSF is being produced by the choroid plexus, and then it gets into the ventricles of the brain, right? It gets into the lateral ventricle. But take note, most of the CSF is going to be produced by the lateral ventricles. The lateral ventricles. And then from the lateral ventricle, it's going to get into the third ventricle, right? So we actually have um, what we call channels for the movement, right? The channels or foramen where we are going to where the CSF is going to move. So between the lateral ventricle and the third ventricles, the CSF will move via a channel called the foramen of Monro. Right, let's see over here. So you can see right here, right? The foramina of Monro. The foramen of Monro, it connects the lateral ventricles to the third ventricles. So there are two of them from the right, from the left, draining within, draining into your third ventricle. And then from your third ventricle, you're going to drain. The third ventricle is going to communicate with the fourth ventricle. So now the fourth ventricle, it sits in the brainstem, right? Its anatomical position is going to be positioned between the following. Superiorly, right? Superiorly, we're going to have the cerebellum. Superiorly, you're going to have your cerebellum, and then at the side, you're going to have the pons, and then inferiorly, you're going to have your medulla oblongata. So that's where you find your fourth ventricle, right? So it receives via a duct which is called the cerebral aqueduct of Salvarius that will connect the third ventricle into the fourth. And then the fourth ventricle, it's actually going to have three apertures, two lateral and one medial, right? So you're actually going to have the two left lateral, right? So the left and the right lateral, these are called the foramen of Lusca. And then one medial, you're going to have the foramen of Magent, right? The foramen of Magent. Good. So those are the channels or the foramina that allow communication of your ventricle for the CSF to move. So where is the CSF? Where is the CSF going after it leaves via these three foramina, right? It's going to enter what you call the subarachnoid space, right? So the CSF is found within the subarachnoid space. So take note of this. In the brain, we said we have 150 mils of CSF. 30 mils of CSF of that 150 is actually found in the ventricles. And then 120 mils is going to be found within the subarachnoid space. You understand? Right? Good. And then take note of this. Not all the CSF is going to get into the brain. Some of the CSF will continue into the spinal cord. Right? It's very important. It will continue into the spinal cord. As we're going to see, that's why you find that if you want to take or analyze the content, or we want to analyze the CSF of the brain, how are we going to get the CSF? You do what you call lumbar puncture. So lumbar puncture is a process or a procedure where we analyze the cerebrospinal fluid, right? You go to, remember your spinal cord, it ends at the level of L1, L2 there, right? So it is important to take note of that lumbar puncture. You're going to insert a needle at around L3 and L4, not above L2, because you might damage the spinal cord, which is very delicate. So you're going to have your lumbar puncture there, and then you take the fluid. We measure the intracranial pressure of the fluid. We measure the concentration of substances in the cerebrospinal fluid. If you see that there is an abnormality in glucose, in potassium, then you're going to suspect an infection within your brain. So that is what you call lumbar puncture. So lumbar puncture, it is taken around level of L4, L3. You insert a needle there, and then you take your CSF with no problem. You understand? But if it is a fetus, it's very easy because the anterior fontanelle and the posterior fontanelle, they're actually open before 18 months. So you can actually access these ventricles via the anterior and posterior frontal nerve. I think we did this in head and neck. You understand? Good. So it's very important as far as lumbar puncture is concerned. So take note of this. Not all of your CSF will remain in the brain. Some of it will go in the spinal cord, and then it leaves the brain via this foramen, enters the subarachnoid space, that is about 120 mils, and then the 30 mils will remain right in your ventricles. Good, good, good. Now, let us focus on how this cerebrospinal fluid is going to be absorbed. We have spoken how we increase cerebral blood flow, and we spoke of the production of the cerebrospinal fluid, and then we spoke of the movement of the cerebrospinal fluid. Now let us talk about the absorption of this cerebrospinal fluid. Right. Absorption is very important, very much important. So you really have to understand. So let's get into another diagram. Right. So for this to be well understood, let us get back to some head and neck principles. Right. So the anatomy, we have what we call meninges. Right. So right here it shows the layers of the of the head. Right. So outside we have the skin. We are going to have your connective tissue, your upper neurotic layer, your loose connective tissue, your pericranium. We did this in head and neck. And then you're going to meet your skull. The skull that's going to be divided into external table, a diplo, and internal table. You understand? And then from that now, let's get into the layers that covers the brain. So you're going to have the three main layers, right? You have what you call pia mater. So pia mater is going to be highly vascularized, and it is firmly adherent to the brain surface, and it is continuous in the brain contours. You can see this red layer. That's your pia mater, right? And then from the pia mater, you're going to have what you call an arachnoid mater. This in white. This is your arachnoid mater, right? Your arachnoid mater. So between the arachnoid mater and the pia mater, there is a space. That's the famous space, the subarachnoid space. So this is where you find your cerebrospinal fluid coming from. Where? The foramen of Luska, the foramen of Magintu, right? Good. And then it gets into this space. And then we said we have about 120 mils of cerebrospinal fluid floating, right, every 8 hours of a day within this space, right? And then this arachnoid mater, take note of this, though it may have vessels, but it is avascular and it is not innervated. Avascular and it is not innervated. You understand? Avascular and not innervated. The pia mater, very much innervated. So the arachnoid mater and pia mater, both of them, they are called the leptomeninges. So they just referred as the leptomeninges. Right. Above the arachnoid mater, you're going to have what called the dura mater. So the dura mater is the one that is going to be divided into two. There's going to be a layer of the dura mater that will be firmly adherent to the brain, to the skull, the inner aspect of the skull, which is called the endosteal layer. So this is the endosteal layer right here. You can see this one, endosteal layer. And then you're going to have, from that, you're going to have a meningeal layer. So the dura mater is going to be made by an endosteal layer and a meningeal layer. So between these layers, that's where you find your subdural veins, right? Subdural veins, right? Good. Your superior sagittal sinuses, or your sinuses, right? Right, which is very important, right? So take note of this. If you are going to have from head and neck, we said that the damage to the pterion will result in epidural hemorrhage, right? So this is the medial meningeal artery. So the medial meningeal artery if it is damaged, it will cause what you call epidural hemorrhage. So epidural hemorrhage, you can see that this bone, the bone of the skull is sutures. We are going to have this the coronal suture, sagittal suture, lumbar suture, and all those. And this endosteum is going to be firmly adherent to the bone and these sutures. So if you are going to have epidural hemorrhage, the epidural hemorrhage is going to be arterial. Mainly epidural hemorrhage, they are arterial, not venous. They are arterial. And they are going to bulge, and they form a shaped bulging, because they'll be between sutures, right? So we are going to form a potential space here. So take note of this. The epidural space, in the brain is not a space that you can see. It's a potential space that is seen when there is hemorrhage. But right here, you cannot see it, right? But if this artery bleeds, blood is going to accumulate here. And then it's going to bulge and form like a lens shape bulging. And epidural hemorrhage are arterial. NB, they are arterial. Good. And then if you have subdural hemorrhages, right? Subdural hemorrhages, which means that you have affected your subdural veins. So the subdural hemorrhage, it's always venous in nature. And it's going to be crescent shaped. This one is going to be lens shaped. This one is going to be crescent shaped. So these are your meninges, or the meningeal. So you're going to have an endothelial layer and a meningeal layer, right? These layers, they are highly innervated, right? So most of the part of this layer is going to be innervated. The dura mater is going to be innervated by branches of the trigeminal nerve. But the one that is around the occipital region is going to be innervated by C1 and C2, right? So remember, in the posterior cranial fossa, we had a hypoglossal foramen. The hypoglossal foramen, it would travel with allow the passage of the hypoglossal nerve. But when it comes here, the hypoglossal nerve, it also travels with fibers of C1 and C2. And those fibers of C1 and C2, they are the ones that will go and supply the meninges around your occipital region, right? So within these dural, so this is dural, right? Dural mater. That's where you have the extension of the arachnoid. So remember, this is an arachnoid, right? You have an extension of the arachnoid getting into these dural venous sinuses. So these are called arachnoid villi or arachnoid granulations. So your cerebrospinal fluid within this green layer, right, is going to be drained into the venous system, with the subdural venous system. Let's take a look. Right, so let's take a look what really happens at this area. Let's zoom in. All right, so let's now take a look at the production. Okay, we saw the CSF production. Now we are now in the CSF absorption. Okay, so right here, this is another schematic diagram as far as the absorption is concerned. So these are your granulations, right? So the cerebrospinal fluid is going to move via these granulations, entering this venous sinus, the subdural venous sinus. What is important to understand is there is a high pressure in the subarachnoid space, and these arachnoid villi, they are unidirectional valve, which means once we get cerebrospinal fluid in the subdural space, it does not go back. It's a one-way valve. You understand? Look at this diagram. Right, so it's fine. We can use this one. So I'm saying that this is a unidirectional flow. So you have blood in here, you have CSF in here being drained here. Take note of this. The pressure does not affect. The pressure affects absorption, but does not affect production. Very important. Please understand this. The pressure. So you have about this the pressure of the CSF. You have about 70 to 180, right? Um, 70 to sorry 70 to 70 to 180. Some texts say 100 to 130 millimeters of water. That is 7 to 13 millimeters of mercury. You understand? That's the normal pressure. If that pressure is to increase, which we say intracranial increase of CSF, is not going to affect, is going to affect absorption, truly, but it's not going to affect production. So no matter how much pressure we're going to have, we are just going to continue to produce. There is just going to be a continuous production. That is why it is very important. If these arachnoid granulations are occluded, are inflamed, are blocked by subdural hemorrhage, you are not going to have the CSF being drained normally. So you're going to have accumulation of the CSF. So accumulation of CSF is going to lead to what you call hydrocephalus. 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 Hydro accumulation of the CSF. You understand? So this accumulation, which is a hydrocephalus, can happen in two ways. Either you have actually destroyed the arachnoid granulations, or you have actually blocked those. Okay, let me show you. Right, so you can actually block, especially this foramen, the foramen of Lusca, the foramen of Magentue. They can actually be blocked, and then you can actually lead to hydrocephalus. That would be obstructive hydrocephalus. You understand? So this is very important. This is very important. So we have spoke of production, absorption. Now let's just take a look in the next 2 minutes, the blood-brain barrier. The blood-brain barrier. So your brain parenchyma does not communicate with the blood. Very important. You're going to have a barrier, right? But in the area where there is choroid plexus, we're going to have a separate video for the blood-brain barrier. In the area where there is the choroid plexus, the hypothalamus, the pineal gland, the vomiting area, right? You're not going to have the blood-brain barrier there. We're going to look at it very soon. So guys, this is our video. I hope this helped you. If it has helped you so much, please comment and tell us if you want more of these videos. Thank you so much. See you next time. Goodbye.